This is the very basic analytical procedures. Okay. So we will try to have an interactive session. So the overview of the presentation will be, first, what is data? Then we have ways of data presentation. Some important distributions, concept of central tendencies and variations, a very important concept, standard error, very closely related to your confidence interval, and then we will be having sampling techniques. Okay. So very first thing, what is data? Okay. So what do you people feel? What is data? Any idea? Data से क्या समझ रहे हैं हम? What is the data? Just last seat. What is data, Khushbu? What do you feel? After research, the observations. Okay. Anything else? Data? Organized information. Or organized information? Data? What is data? If you are a vegetarian, I tell you, and you have a choice of matar paneer, so data is your paneer. Okay. Some popular definitions what we are having. It's facts or information. It may be in the form of numbers. It may be in the form of pictures. It may be in the form of videos. Okay. Data is not only number. Okay. Data is fact or information. It can be in any form. It is when we are precisely dealing with the data which is in numbers, then it is called the language of science. So precisely if we say it is the raw material of science waiting to be published. Why it is important? Why data is important? Because it addresses a very, very important question. It may tell us about the direction or the magnitude of the problem at our hand or the outcome of our interest. What is where the data is tending you, the problem is going in which direction, or what is the magnitude. For example, if we say body temperature, if I am saying body temperature, say 101, 102, 103, that means we have a definite idea about the magnitude, 100, then 101, then 102. And we have a definite idea about the direction as well as the magnitude. Look at the second example, socioeconomic status, low, medium, high. So if I say low, medium, and high, someone has used a Biju Prasad classification for SES classification. Someone has used a WHO classification. So you are having a definite idea about the direction, that it is low, medium, and high. That means the economic condition is slowly it is increasing. But what is the difference between low and medium? You may not tell precisely because you may not be able to know that whether he has used which classification. So you are having a clear-cut idea about the direction, but may or may not have the clear-cut idea about the magnitude. Third one, disease symptoms. Okay, there are many diseases which are having common symptoms. So you are not that, in this case, third example, the data is not telling you precisely about the direction or the magnitude. Okay, so these three data are of three different natures. Okay, if you keep on accumulating body temperature data, you would get to know what is the normal range of body temperature. Okay, that's why the medical records section is given so much importance. The disease etiology plays a vital role in if we are having a sound medical record system. In the second one, we are having the idea about the direction, but not the magnitude difference. And the third one, we are not having any idea about the direction or the magnitude, but it doesn't mean that it is not important. It is also important. We will come on that. Okay. So if you have basically our data is of two kinds. One is your quantitative data and the second one is your qualitative data. Okay. Lot of definitions are there in the book, but if I say quantitative data, if your data tells you a definite, give you an idea about the magnitude as well as the direction, then the data is your quantitative in nature. It will not vary from observer to observer. BMI I have calculated, you have calculated, someone else has calculated, and if we are using the same instruments, same classifications, we will be getting the same results. Okay, but intelligence, if I am assessing, someone else is assessing, okay, then it might happen that based on our attribute, we might have different observations. So if the data is giving you a clear-cut idea about the magnitude and the direction, and it is not varying from observer to observer, then the data is quantitative in nature. In science, generally we are giving more importance on quantitative analysis than qualitative analysis. Why? Because qualitative analysis, it is very difficult to generalize it. It will vary from observer to observer. Okay. So to establish generalization of qualitative statistics is very difficult. Okay. Now, as we have in SI units, we measure your height, weight and all that. Similarly, for measuring the data, we have certain important scales. First one is metric scale. The quantitative data we measure on metric scale. Within metric, we have two classes. One is your interval class and second one is your ratio class. Okay. So interval and ratio, only difference between the two is that in interval scale, absolute 0 is not having a clear meaning. For example, if I say 0 degrees Celsius temperature, it doesn't mean that the temperature is absent. In Kelvin, Fahrenheit, you will be having certain values. But if I say a student has scored 0 in his examination, here it means that the student has not done anything. In any scale, he is not going to get any improvement. Okay. So if absolute 0 has a clear, is having a real meaning, then we say that it is measured on a ratio scale. If absolute 0 does not has a true meaning, then we say that it is measured on a interval scale. The second one, the qualitative data is often measured on nominal scale. Nominal scale means that, as the name suggests, segregation of the data merely on the basis of names. For example, blood group classification, OAB. It doesn't mean that an individual of O positive is having a different attribute compared to other one. But for the proper management of the blood groups, we have segregated it into different categories. Player jersey number. Tendulkar is having jersey number 10, someone is having jersey number 1. It is not showing that someone is better than the other. Just for the identification purpose, we have segregated it. Disease symptoms. All these are examples of nominal scale measurement. Sometimes what happens, the data is purely metric in nature. For example, we are having BMI, blood pressure. You can precisely measure it. But what happens is that for the proper management, if the person is normal, it's okay. If the person is stage 1 hypertensive, we would be having this type of intervention. If he is in second stage, we will be having second type of intervention. So if the data is such that, then we have another class of classification, we are calling it as ordinal scale. So here you may not have a definite idea about the magnitude, but you are having definite idea about the direction. For example, disease severity, mild, moderate, severe. Okay. So you know that the patient condition is getting deteriorated. But what is the difference between mild and moderate is not very clear. Okay. For some physician, there might be some overlapping. Okay. So before treating your data or before going for any analysis, this is a very first important step to consider. First, what is the nature of the data, whether it is qualitative or quantitative, first thing. Second important thing which you have to look is that what was the scale used to measure it. So you have to remember, If it is quantitative in nature, absolute 0 has a true meaning, it's a ratio one. If absolute 0 is not having a true meaning, it's an interval one. Second, if the data is not giving you any idea about the direction or the magnitude, then it is a nominal scale. If it is giving you a definite idea about the direction, but may not give you the definite idea about the magnitude difference, then it is a ordinal one. Based on this theory, your entire statistic is done. Okay. Why? Because no one is interested in the raw data set. Okay. We are all interested in the basic overall summaries what we are using softwares. And as I say that softwares are innocent. Whatever you tell them, they will do that. And you tell them for this type of a data, I want a pie diagram, he will make. If you tell them make a line diagram for this diagram, he will do it. But you should know the basic science behind that, when to apply which graphics. Okay. So this some major data collection techniques. One is your observations in your clinics or in your study. You are observing what is happening. You are doing some experimental RCTs in surveys, and from the document analysis also you are getting some data. Now, from here onwards, we would be focusing more on the quantitative analysis. Okay. In this entire workshop, we would be focusing more on quantitative analysis, not the qualitative analysis. So, quantitative methods, research situation with at least one independent variable, which is manipulated by the researcher. Okay. So, it is a type of analysis where you are having at least one variable which is measured on a metric scale. At least one variable. Now, often we will be coming on the types of variables. Variables is nothing but it is a piece of information which you are collecting. It can be discrete, it can be continuous. Discrete, if I say, it means that it can take only few values, not all the values. For example, birth order 0, 1, 2, 3, like it is possible, but we cannot have a birth order of 2.5. Okay. So, if your variable is such a nature, it is taking only certain possible values. Okay. In that case, if you plot them, you will be getting a step function. Okay. And if you are having a variable where the variable can take all possible values within certain limits. For example, if I say my height is 167 centimeters, it means from 0 to 167, at each and every point, my body is having certain height. Okay. So, when you plot a continuous variable, you will be getting a continuous line within certain limits. Okay. So, by just looking at the graph also, you can tell the nature of the data, whether it is continuous variable or whether it is a discrete one. Now, once it is decided what is the nature of the variable, generally in our analysis, we have two types of variable. One is your independent variable and the second one is your dependent variable. Independent variable, the variable in the study under consideration, may be the cause for the outcome of the studies. You are doing a study on, say, causes of cardiovascular diseases, and you are having certain variables, say socioeconomic status variable, you are having demographic information, you are having family history. So, all these variables may be your independent variables, and from that, within that variables, there might be some proximate variables on which your outcome may depend. For example, family history. Okay. Dependent variable, the variable being affected by the independent variable. So, in this examples, the cardiovascular disease is our dependent variable. Age, family history may be your independent variables. So, generally we are getting this type of function to define the dependent and independent variable, where y is your dependent variable and x is your independent variable. Okay. For example, age of gestation, we are having x, baby weight y. So, as x is increasing, y will be also increasing. So, y is depending on x. What makes a good quantitative research design? Okay. So, epidemiological research design is a topic which we will be covering tomorrow. Okay. But there are 4 key elements which will on which it will depend whether the study design which you are using is a good one or not one. First one is freedom from bias. Generally, your study design will be having some type of biasness, but ideally, there are two types of bias which one should control. One is your selection bias and the second one is your measurement bias. Okay, so these two types of biasness are there when while conducting epidemiological study design. We try to minimize these two types of biases. Freedom from confounding. Confounding variables are those variables which are of not our interest, but which directly or indirectly alter our outcome. Okay, say stroke is there, and say we are having a trying to have an association of stroke and say alcoholism. Okay, and smoking is not the variable of our interest, but it is altering the outcome. All the alcoholic people major are there who are having smoking also. So in fact, we are getting a high significant p-value because of your smoking. So the third variable, which is not of our interest, is altering our outcome. Control for extraneous variables. So there might be some interaction effect between the variables. A third modifying factor is there, because of which the relationship between independent and outcome variable is getting altered. Okay. The fourth one, whatever the values you are getting from the test, it should have high validity and should have a high reliability. Now, first, this was all about the data. Okay. Now, we are having the second ways, that is ways of data presentation. How you are going to present the data. So, basically, there are three ways of presenting the data. Tabular one, then we have graphics, and third we are having the numeric one. Okay. So, what do you feel, which one is the best one? The tabular one, the graphic, or the numeric? Graphic? Everyone agrees? How many agrees? Please raise your hand. Graphic? Okay. And this tabular or numeric? Few are in favor of tabular and numeric. So let's look at some good examples, starting with the graphical presentation. Okay. So here we are having an example from a bike shop sales. We are having some categories of the sales. Okay, bike sale is there, clothing is there, accessories are there, and we have used some good graphics. Let's see what inference we are getting. So sales category is there. The topmost we have used a 3D pyramid diagrams. The first one is the bike, second one is your components, third one is your clothing, and last we are having accessories. By just looking at the graph, if you are not looking at the pictures, numbers, if you are just looking at the graphs, which one is having a higher magnitude, which you feel? The green one is having a higher magnitude, or the last base one is having a higher magnitude? A second analyst is there who is analyzing this, and what he is doing is he is not using a 3D one. Now look at the base, which we feel is having a greater magnitude. The inference has got changed. Now, which one is you feel is having a higher magnitude? More important? Green one? Okay. Now we are having a third analyst. Now here, blue. You told that the graphic is having the most powerful inference we are getting from that. Now we are having a fourth analyst. Okay. Now we are having one more analyst. He is using a different diagram. Okay. Now here you see that there is more information. Although the bike which we see in the bar diagram is having the highest magnitude, but we see that the growth is happening in the March end, when we are having some income tax calculation and some companies are giving some offers. But throughout the year, there is no increase. Okay. Only in March and April, we are having a high increase, and rest of the years, it is more or less, it is constant. So, and for the components, if you see for the components, more or less, we are having a upward magnitude. Okay, so the inference is changing. So still you feel the graph is having upper hand. So a lot of information is lost if you are using a graphical diagram. Okay, but it's not that ki data science is not very simple. It's not that ki I have given you this, that means ki we should criticize graphical presentation. Let's look at another example. Here we are using numbers. Okay, and based on numbers we will try to make the inference. Okay, so we are having 4 data set: data 1, data 2, data 3 and data 4. Okay, all of you know about the summary statistics. I am not, we will discuss on that thing, but basic statistics of these 4 data is presented. We are having the mean value 7.5. For the second data also we are having the same mean. We are having the sample variance, which is also the same. That means the dispersion in the overall data is also same. Standard deviation, which is nothing but it is the square root of this thing, is same. Okay, sample variation repeat हो गया दो बार. और एक last वाला जो है ये है standard error. We will come on that. But here also we are getting the same. So based on the numeric presentation, what we feel, all the 4 data sets are same. Can we say that? देख के बोल सकते हैं कि नहीं बोल सकते? बोल सकते हैं, नहीं बोल सकते? क्यों? देखने में तो क्या गड़बड़ है? नहीं. Okay, so you are having some confusion with this. ठीक है. So how much different it will be? You can feel any? Will it be? Oh, okay. Let me say that all the data sets are of same size. It is of same size. You can analyze this data. I have used this data only. All these data are of same size. N is same. Sample size is not different. Sample size is same. Okay. Then is it both all are telling the same picture story? Is it same? ना ऐसा लग रहा है ना देखने से. Apparently ऐसा लग रहा है. Okay. Now let's have a graphical presentation of this data set. This is the first data set. On the y-axis we have the dependent and x-axis we have the independent. First one is telling us a linear trend. Second one is having some type of parabola. Third one is again having a different shape, and fourth one is entirely different. So our inference is changed. So it's not that only one thing is better, ki you go with the graphical presentation or you go with the numeric presentation. In data set you have to do a lot of research. Data को काट के, उलट के, पुलट के, ट्रांसफॉर्मेशन करके, सेंटरिंग करके, बहुत सारी चीज़ें करके देखना है, and then you can come on the conclusion कि what is happening, because data analysis is a difficult job. ठीक है, तो उसमें जो पहला चीज़ हम लोगों को ध्यान रखना है, the very first one is the nature of data, scale used, and we have to give more importance on the exploration of the data. Directly do not jump on regression analysis, we will do a correlation analysis, we will do a meta-analysis, but first try to understand what is the nature of the data. Okay, and in that descriptive statistics or analytical procedures is a vital thing. Okay. So how to present the data badly? I want that you should know these things so that we should not commit these types of mistakes. Okay. Okay, now as we have the 3 important presentations of the data, starting with the first one, that is the tabular one. Okay, tabular presentations, there are some simple general principle guidelines. Generally, we have a formula. If you have a raw data set and you want to have a tabular presentation, there is a mathematical formula to decide on the number of groups. Okay, but ideally, we should not have more than 15 groups. Okay, whenever you are having a tabular presentation, try to number it, try to give it a title so that it is self-explanatory. It should not be like that ki someone has to tell that in this we have done this thing and your data findings are not matching with your title. Okay. Vertical arrangement, some people find it better because we are good at catching the vertical images. Types of tables, we have two types of table. One is your simple table and the second one is your complex table. Simple table generally we use when we are dealing with the exploratory analysis. Descriptive statistics निकाल रहे हैं, mean, median, mode निकाल रहे हैं, overall range बता रहे हैं. Then we go with a simple table, one way analysis कर रहे हैं. जब हम two-way analysis कर रहे हैं या more than two-way analysis कर रहे हैं, then we go with the complex tables. Okay, so we are having more than two factors considering same at a time. Okay, so although if you keep on increasing the ways of analysis of the data, although it may look very catchy, but it is very difficult if you are using, as the ways of classification is increasing, your inference is getting little complicated. Okay. Now, when to use which graphics? Okay, the very first one, bar diagram. Okay, how to make a bar diagram, SPSS will do that. But what we will see is that what are the basic concept when to apply bar diagram. The very first one, data is qualitative and is measured on nominal or ordinal scale. Okay, so data is generally, when we used to make a bar diagram, ideally we should make it when the data is measured on a nominal scale or ordinal scale and it is qualitative in nature. Sometimes the data is of metric nature but is measured on an ordinal scale. Then also you can make a bar diagram, simple bar diagram. Distribution of patients according to blood group. Here what is important in bar diagram? The height of the bar represents the quantity of interest. The groups or categories are placed on the horizontal axis, and since it is measured on a nominal scale, so the groups are disjoint. That's why we try to have a different color or a different pattern whenever you make a bar diagram. In bar diagram, generally we have three types. First one is a simple bar diagram, then the second one is adjacent bar diagram. So adjacent bar diagram, for making adjacent bar diagram, the first condition is same, that is data is qualitative and is measured on nominal or ordinal scale. Adjacent, for this we need one more information, that same piece of information is compared in two different setups. Blood group distribution at your RSTC, USTC. Okay. Then for two places you can have two adjacent bars. One is for RSTC and second is for the second place. Third one, component bar diagram. When to make a component bar diagram? When we are interested in the component of a variable rather than the variable itself. For example, causes of maternal mortality rate, MMR. So we are interested in MMR, but we are more interested what are the causes for MMR. It can be low age marriage, it can be anemia, it can be pregnancy complication, it can be something else. Okay, so here we are having a bar of 100% height. Okay, same heights, but within the bar there would be some variation. Okay, so these are the three pictorial presentations. First one is your simple bar diagrams. Children were asked about their color preferences. In the second one, we are having distribution of boys and girls in different groups. In the third one, we are having, say, causes of MMR in 4 health setups. Okay, so we are comparing the bars. Okay. Now, I hope bar diagram is clear to everyone. Anyone is having any query with respect to bar diagram? When to apply which bar? Okay. Second one, when to use a pie diagram? Okay, ideally we should try to avoid the pie diagram. Okay, why? Because it's not a good way of presenting, because here the quantity of interest is the segment of the pie. Okay, so it is difficult to catch the angles. Okay, compare the angles. Okay, so whenever it is possible, if you are given a choice, you can apply a bar diagram or a pie diagram, go for a bar diagram. Okay, but what is the condition when we should ideally make a pie diagram? So ideally when we should make a pie diagram, when the events are additive in nature and in totality it has a meaning. Okay, for example, we are having age specific fertility rate. Okay, and we are given age specific fertility 15 to 25 this, 25 to 30 this, 30 to 45 this. So if we are adding all these age specific fertility, we are getting a cumulative figure which we are calling it as total fertility rate, okay, TFR. So if your events are additive in nature, then you can make a pie diagram. Here the quantity of interest is the segment of the pie, okay. The segment of the pie, which is angle is calculated pi into your percentage, okay. So here if the quantities are additive in nature, then only we should make. If you are having disease symptoms, okay. So if you add all the disease symptoms, will you be getting a particular type of disease? Yes or no? Is it additive? Disease symptoms? It's not additive. There are many diseases which are having common symptoms, okay. So ideally you should not make a pie diagram here, okay. Now coming on, another important diagram which is histogram. When to use histogram? When the data is quantitative and is measured on ratio or interval scale, the variable should be continuous in nature, okay. So if the variable is continuous in nature, measured on a ratio or interval scale, we can use a histogram. In histogram, the quantity of interest is not the height of the bar as we were having in the bar diagram. Here the quantity of interest is the area under the bar, okay. For here we have given one example where we are having distribution of age group in different categories. From 18 to 25, 25 to 30, it is having 5, that is having 7, then we have 30 to 50. Oh, you can see that the width is varying, okay. So ideally, if you have a clear-cut idea about the base, this one, what should be the difference? 18 to 25, 25 to 30. If you are having a sound scientific background, we should decide on this width, then you can choose unequal width. Otherwise, try to make a equal width. So if it is of equal width, then the height of the bar would be the quantity of our interest, okay. So when the data is purely quantitative in nature and the scale used and the variable is continuous, we are making a histogram. Histogram is a very important diagram. Why? Because it is an initial point which is giving you the idea about the distribution of the data. If you look at this, you can see that data set में more or less values 5 और 7 के आसपास ही है. Similar type of diagram कुछ दिख रहा है, ज़्यादा वेरिएशन नहीं है. लेकिन हिस्टोग्राम में अगर if you are getting by joining the midpoints of a histogram, if you are getting a bell-shaped curve, you can have a different type of distribution. If you can have a higher tail to a particular direction, you will be having a different type of distribution. We will come on that things. So histogram ideally when we should make when the data is measured on a metric scale and the variable is continuous in nature. Unlike bar diagram, here the quantity of interest is area under the bar, as I have told. Now, three important bar diagrams are there. Line diagram. This kind of diagram is best used to show trend and the measurement is on metric scale. Scatter plot, a very important one. We have seen using the scatter plot how the inference was getting changed. Okay, so this is generally used when we are more interested in the association, what is happening in the outcome variable if we are changing the independent variables. Box-whisker plot. Use a box-whisker plot when the desired outcome from your analysis is to understand the distribution of the data points within a range of values. Generally, as the name is saying, we are using a box, and within the box, if your data points are lying within the box, then we say that your data is more or less homogeneous. And if the points are lying outside the box, generally it is an indication that your data set might have outliers. Okay, so with the outside the box, we are having two hinges. If the points are lying beyond that hinges also, then we are saying that in your data set we are having extreme outliers. So if in your data set you are having extreme outliers, it is a very critical indication that you should check the distribution once again. Let me give you examples. For example, if you are having a bacterial growth, okay, initially you might be getting all the data points within the box and you may assume that it is having a normal distribution. But as the days increase, you might get points, more of the points outside the box, outliers, and you might get a positively skewed curve. So by observing the first few data, you may say that it is normally distributed. But after observing 3, 4, 5 data, you feel that there are more data points who are lying outside. So if in your data set you are getting outliers, you should be very, very conscious for checking the distribution. Okay. You should not delete the outliers as it is so. You should check what was the reason behind the outlier. Okay.